to New Orleans, Louisiana for this special edition of Health. As you can hear, this city is still very much alive with the sound of music. But 5 years after Hurricane Katrina and still awash with worries over the oil spill, how do people here keep their spirits up? Well, this week we'll be travelling to the Gulf Coast and meeting families affected by the BP accident. Wondering, worrying about what their future might bring and whether or not the petrol pollution could harm their health, they share a stress that residents of New Orleans know all too well. Hit full force by Hurricane Katrina, lives were thrown in turmoil. We'll be visiting the Musicians Clinic, which, providing healthcare to the uninsured, has kept these streets alive with melodies. Health insurance in the US is a major issue, and before we head back, we'll be looking at the effect the health reform could have here in Louisiana.
New Orleans, coming to you live.
According to recent research, there's been a greater increase in stress since the oil spill than there was after Hurricane Katrina. The result, perhaps, of an accumulation of difficult situations, or the fact that the type of anxiety created by each event is psychologically very different. Well, we're going to go and meet with doctors and locals on the ground to see what today's biggest challenges are and how to deal with them.
Ever since Hurricane Katrina, many people in Venice have been living in mobile homes. Like Kendra, she lost her home and now faces a new trauma, the oil spill. During the disaster, Kendra fled with her children to Baton Rouge. Today, they returned to their home, but for them, life will never be the same.
Well, I love being here, but it's sad that I can't go outside and play in the mud puddles and all. That's what I used to do, but now I can't.
Kendra is learning how to deal with the aftermath. She refuses to eat shrimp and is worried about acid rain and makes her children stay at home as she's concerned they're not safe outside. She's exhausted.
I'm glad that the kids are happy and they're back, and I'm glad to be back because it's him, but there's still the daily struggle of not knowing as to whether or not they can be outside to play, if they're safe, so on and so forth. Excuse me. I'm sorry.
Anxiety is high in Venice and along the rest of the coast. Cases of stress and depression are on the rise. According to the latest figures, the rate of mental illness is even higher than after Katrina.
So we've seen essentially a doubling of the incidence of probable serious mental illness, actually to levels that may even be higher than they were after Katrina. This brought out some of the feelings that have been suppressed and buried, kind of the post-traumatic feelings that people had after Katrina.
At the heart of the anxiety is concern about the economy. How do you survive the catastrophe? Young people are often the most traumatised. Families are worried about their health.
What I'm really in fear of is the first 60 days. You know, they sprayed so much dispersant, there was so much petroleum coming out of the oil with all of these different chemicals coming out, all of the little itty-bitty doses.
The oil spill is seen as a human error, and it's hard for those affected to forgive. Whereas the memory of Katrina, 5 years on from the natural disaster, brings the community together.
When we hear the words New Orleans, most of us instantaneously think of music and all that jazz. Yes, this city was built on its own flavour of rock and roll, but it took a battering in Hurricane Katrina. Hospitals were flattened, putting enormous pressure on small health clinics. We're going to visit one now which is desperately struggling for funds, but determined to keep this city's heart beating. Singing away the waiting time, Helen has been a musician in New Orleans for 8 years now. She is starting to find her feet, but music doesn't always pay the medical bills.
I make my living 1 gig at a time, tip jar, you know, and for the first, 4 or 5 years especially, it was, living hand to mouth pretty much, but loving it, and I found out about the Musicians Clinic.
Helen is just one of the many melody makers attending this clinic, which has been offering artists free healthcare since the late 90s. reserved for the creative types, some of the patients have even used the centre as inspiration. Writer Davis Rogan featuring it in an episode of the TV series Treme.
Antoine!
Hey, Miss Catherine.
You need to drop 20 pounds.
Woman, you always say that.
And it's always true. It would lower your blood pressure, though.
Appears telling trombone player Antoine Wendell Pierce, who plays trombone player Antoine Baptiste, she appears in one scene and tells him that he needs to lose some weight so it would lower his blood pressure, which is a line coming directly from what Catherine Rasperge tells me on several occasions.
Indeed, artists are known to lead less than the healthiest of lifestyles, working late, sleeping little and often drinking. Added to sometimes stretched incomes, depression and stress rank among the most common of complaints.
That made my blood pressure go up.
What? Oh, the price of the medication. You eat salty
The clinic also helps musicians financially.
And they got funding for us for different projects at our homes where we didn't have enough money. Like they helped me with my air conditioning, they helped me with carpentry work, and all kinds of stuff. And that's because of this musicians clinic. Thank you,
Following
Catherine.
Katrina, with many hospitals gone, the musicians clinic got a government grant to help them cope with the surge in patients. But this is now coming to an end.
The problem is, it's going to be difficult for us now. We had to end a lot of our programs. We had to end all the counseling, mental health programs, the dental program, some of the labs.
And while the Musicians Clinic hopes that more money will be awarded, it continues to do what it can to keep New Orleans musicians playing their pianos, or strumming their strings or blowing their trumpets, and keeping the heart of New Orleans alive. Here in New Orleans' lower 9th district, just 1/5 of residents have returned since the storm. X's still mark the houses deemed uninhabitable, with mould wallpapering the walls. Here, people often have to use their own means to try and reconstruct their own lives, given little help from the outside. Like these houses, they feel abandoned. And it's a feeling shared across Louisiana, one of the poorer states. It has a higher than average share of uninsured adults. So what change can the health reform bring to people here?
Bumps ahead on the road to universal health care coverage. 20 states, including Louisiana, are suing the federal government in an effort to overturn the new health care law. Approximately 20% of Louisiana's residents lack health insurance, and some doctors worry the new mandate will penalize non-citizens.
And when is your next?
What we're hopeful is that more people will have access to care. But what I think we'll probably unfortunately see in reality is more of a discrepancy between those who are U.S. citizens and those who are not U.S. citizens.
Even though Louisiana is fighting to overturn the Affordable Care Act, the state is taking advantage of at least one of the provisions already available: help for covering early retirees. An estimated 60,000 residents retired before they were eligible for Medicare. By offering a generous subsidy, the Early Retiree Reinsurance Program will help ensure continued coverage.
Well, it's here in New Orleans French Market that we're going to have to get ready to go back to Paris. That brings us to the end of this week's show. A big thanks to the man on the other side of the camera, Jérôme Bonnard. Thanks also to Young Shim and René Kaplan. I hope you enjoyed, and I'll see you again next time.